Sure. Well, thanks, Norbert, for pulling this together, and thanks, Heather. I think that was really moving and so true that there's just a tremendous amount of power that we can actualize if we work together and organize. So thank you everyone here for taking that first step and showing up tonight. My name is Brun. I'm the executive director of Mainers for Working Families. We're a nonprofit that basically tries to give Maine's working families and small business owners a fair shake in an economy that is increasingly stacked against them. So we actually don't work in the electoral space. We don't work on elections, but we specifically in Maine advocate for more affordable healthcare, for a more fair tax system, for a stronger and more accessible democracy, for workplace policies that make it easier for folks to live and work and raise a family in Maine. And you know, in the past few years, we've had a lot of successes, and the Maine legislature of late has passed just so many policies that really have grown opportunities to help working families thrive here. But one of our biggest priorities has been a work in progress since we started this organization about 3 years ago. And before us, advocates in Maine have been fighting for decades to make this a reality. And I'm talking about passing a paid family and medical leave program that covers every worker in our state. They get sick, or if they need to care for an ill family member, or if they're welcoming a new child into the world. You know, a lot of you may know this, but the United States is one of only 7 countries in the entire world that doesn't provide universal paid family and medical leave. You know, thankfully, there's precedent for enacting this at the state level. And currently, the District of Columbia and 11 states have passed a paid family and medical leave program. Maine, unfortunately, is not one of them. And you know, federally, we do have a Family Medical Leave Act, and Maine actually has our own unpaid family medical leave provisions, but only around 55 to 60% of Maine workers are actually eligible for one of those programs. And even for those who do have access to that unpaid family medical leave, most workers just can't afford to take an extended period of time off from work without getting a paycheck. And that's why we go to work. You know, right now, only 15% of Mainers have access to some kind of paid family and medical leave as a result of a decision their employer made. You know, and one result of that is that 25% of Maine mothers go back to work within 2 weeks of giving birth. You know, beyond the obvious stress that this places on new parents, there's measurable health consequences for our children as a result of this. You know, it's California, which passed a paid family and medical leave policy a number of years back, found that their program resulted in a 5% increase in children receiving both their hepatitis B shots. They found that the median number of weeks that mothers spent breastfeeding almost doubled after they passed this policy. And they found that there was a correlation between this policy and a reduction in obesity and ADHD and hearing problems in young children. And of course, this isn't even to touch on the health impacts for new parents who have access to paid leave, or for ill or ailing folks who are now able to be cared for in their homes by family members who are taking paid leave. You know, Maine is the oldest state in the country. Florida's right there after us. And you know, where I live and grew up, it's extremely common for workers to have elderly or ill or disabled family members at home that they take care of when they get back from work. You know, when I was a kid, my grandmother became unable to care for herself, and she moved in with my parents and my brother and I, and my folks took care of her. And you know, towards the end of her life, she needed pretty near constant care, but my parents still needed to work. You know, my mom was a nurse. She'd leave the house at 6 a.m. She'd come back at 7 p.m. and she'd spend every moment thereafter taking care of her mom and raising my brother and I. And you know, my dad and my uncle and our friends, they'd come and help out, but they all needed to work too. You know, so we had this dilemma. And now I remember hearing my mom crying at night when she didn't think we could hear her. And I remember hearing her tell my dad that she didn't know how to give her mom the care she needed and work all day and be present for my brother. And, you know, as a kid, I didn't understand all the factors that were at play that made that time so hard for my parents, but it was so clear to me, no one should ever have to go through that. But there's so many families out there right now who are in the exact same impossible situation. There's so many incredible people like my mom who are trying their hardest to care for a family member that needs them, but they're stuck with that just heart-wrenching choice of losing their income or being there for their loved one, you know, paying their mortgage or being with their newborn in those critical first few months of life. And what's so frustrating to me is there's an obvious policy solution to this problem, but by failing to act, we're allowing working families to suffer. So I'm going to maybe step up my soapbox a little bit here and talk a little bit about what Maine is doing to bring a paid family medical leave program to fruition. So, as I said before, there's advocacy groups in Maine that have been fighting for a paid family medical leave program for decades. And we're part of a coalition of more than 20 Maine nonprofits that are working on this issue. And right now, because of all that work that has happened for decades, we are closer than we've ever gotten to making this happen. So 2 years ago, our legislature passed a bill that established a paid family and medical leave study commission. And so that commission is tasked with looking at paid family medical leave programs in other states, meeting relevant stakeholders in Maine, and commissioning an actuarial study to figure out what the startup and ongoing costs are going to be for a paid family medical leave. And then once they have all that data, they're going to use it to submit legislation to the Maine legislature to enact paid family medical leave policy, again, based on their findings. So the commission has been meeting regularly, and by statute, they were actually due to submit that recommended legislation to the legislature in the last session. But unfortunately, the actuarial study required a bit more time than allowed for. They weren't able to meet that deadline. Thankfully, we were successful in pushing to get funding for the commission to be included in Maine's last budget, and also to get the commission an extension for their work. So they're now working with an actuarial study firm to get that research completed, and they're scheduled to submit that proposed legislation by November 2nd. This is really exciting stuff, especially after how long this has been in process. But make no mistake about it, ensuring that our lawmakers and our governor, whoever that may be, in 2024, have the courage to pass a program like this, one that requires new revenue sources, right? That's no easy task. And that means that before the legislature reconvenes, we need to make sure that the challenges Mainers are facing without access to paid leave are front and center for our lawmakers. So what we're doing at Mainers for Working Families, and what other advocates in the Maine Family Leave Coalition are doing, is just like what Ask Nurses and Doctors is doing. We're sharing stories from impacted Mainers and trusted experts to really demonstrate what that real human impact is, what can happen when folks don't have access to this critical benefit. And I really believe in the bottom of my heart that these stories from constituents are the most impactful tool that we have to affect change. So if you're from Maine, there's a lot of different ways you can help. All of them are pretty straightforward and require a very minimal commitment, but really impactful stuff. So, first, you can have a quick conversation, about 20 minutes over Zoom, with a member of our team about if you're, say, a healthcare professional, the impact that paid family medical leave would have on your patients, or ways that patient health outcomes might have been adversely impacted by a lack of paid leave options. If you're not a healthcare professional, other ways that paid family medical leave would have impacted your life or did impact your life. And then you just kind of have that casual conversation. And once you're finished, we can edit it down to a 30-second or somewhere between that and 2-minute long video and promote it on social media. We have a great video editing team that puts together a lot of great work, and we'd really love to have as many people as are interested in enjoying that. Another thing you can do, really impactful, same idea, is write a letter to the editor or an op-ed discussing the exact same stuff. And we can work to help you draft this, or we can even draft it for you just after asking a few questions about what your experience is. And once you're happy with that draft, we can submit it or pitch it to Maine newspapers and make sure it gets as much readership as we can possibly get. Another thing you can do, and probably folks are getting kind of familiar with this these days, is you can reach out to your legislators, your state legislators, either over the phone or by email, and ask them to support a paid family medical leave policy for Maine's families. We can help you get your thoughts in order and walk you through the process, but it's really very, very straightforward, and again, a really big impact here. The last thing, and this is for probably a little later down the line, but once that legislation is in front of the legislature, once it's having a public hearing, you can testify. So for the past couple of years since the pandemic started, testimonies for Maine have been happening over Zoom, which makes it just easier than it ever has been to participate. You don't got to drive down to Augusta and wait there all day. To read your testimony, you have a maximum of 2 minutes for that presentation. But if you do choose to do this, you should block off probably a couple hours of your day so that you're available and present when your name is called. you can do your dishes in the background or whatever you want to do. Just so long as you're able to kind of be there when they call on you. We can't guarantee when that speaking order will be. But again, we can help you draft your testimony if you'd like. And even if you're not able to attend the hearing itself, it is slightly less impactful, but you can also submit written testimony, which we could certainly help you with. But the bottom line is that we are so close here. It's so easy to help out, but we can't let this opportunity slip past us. Because no matter how much money you make where you work, everyone deserves to be there for the people they love when they need them. And if you believe that, like I do, Maine families need you to step up and do this really small part. And I really believe that if we can work together, we can make this happen. So thanks again for being here, and thank you, Norbert, for pulling this all together.